Cardiovascular disease has been the leading cause of death in Malaysia since the early 1980s. Health Minister Dzulkefly Ahmad had said that heart disease accounted for an average of 23.3% of all deaths in the nation every year. But how did this happen?
Well, because we have a very high incidence rate of high cholesterol, diabetes, hypertension and smoking.
Dr Ezani Taib, CEO of the National Heart Institute, says Malaysians must go for a health screening at least once a year, emphasizing that prevention is better than cure. The 2023 National Health and Morbidity Survey found that up to 7.6 million Malaysians suffered from high cholesterol in 2023, but half of them were unaware of their condition as it is often asymptomatic.
You have to seek early treatment because the idea is to prevent the disease from progressing and more importantly from becoming a heart disease. At high risk because they've got a family history and then they continue with those risk factors. They know they've got diabetes or high cholesterol, they say it's okay, it's okay. I'll control my diet, which never happens. Or they're smoking and they don't stop smoking. So it's because of that, over the years, they will develop disease.
While major cities have no shortage of clinics and hospitals for checkups, a problem in rural regions is that residents often struggle to access even the most basic healthcare services. IJN has stepped up on more than one occasion to tackle this issue.
We do screening, especially for the underprivileged. For the last 10 years, about 170 plus locations across the country. And not just within the peninsula, we've gone even to the islands off the country and screened more than almost close to 70,000 people.
IJN also signed a Memorandum of Understanding with Putra Specialist Center last year, promising to expand its cardiology services to previously underserved regions.
Melaka itself is a good location because it serves northern Johor, Negeri Sembilan, Melaka itself and Sumatra. By having access to high quality care in Melaka, which means that patients need not come all the way to KL for their treatment.
IJN has not only gained the trust of prominent national figures who personally seek treatment at the hospital, but has also become a preferred choice for thousands of foreign tourists from Europe and East Asia.
We are the MHTC flagship shortlisted hospital. We are one of the 4, the only cardiovascular specialized hospital that's been shortlisted, right? With that labeling, we hope to attract more foreign patients.
Since 2009, IJN has been accredited by the US-based Joint Commission International as one of the 1,000 healthcare organizations recognized for their rigorous standards of care. It was also awarded by Newsweek and Statista as one of the world's best hospitals last year.
We know we are very good, comparable if not better than America. So we actually compare ourselves not to Malaysia, but we always compare ourselves to either American standards or European standards.
Aside from achieving global standards in its effort to deliver quality care, IJN also plays an active role in addressing the shortage of healthcare specialists in the country.
So IJN has always been a very strong training ground for doctors interested in cardiovascular diseases. Okay? Over the last 10 years alone, we have treated more than 1,000 Ministry of Health doctors in various specialty, anesthesia, cardiology, surgery.
Ezani said that with IJN having identified glaringly obvious gaps in cardiovascular care, he is now confident that the college's specialized degree programs and courses will help alleviate the shortfall in medical professionals. Dr Ezani Taib, FMT News.